Hi guys, my name is Dr. Donald Miller. I am with Mill Pond Integrative Health and Wellness. I have been treating different metabolic disorders such as type 2 diabetes, fibromyalgia, other autoimmune conditions like Hashimoto's disease, rheumatoid arthritis, lupus, multiple sclerosis. I've been helping people with these conditions for over 6 years now since I've graduated. I practice what's called functional medicine, and so with the skill sets of studying functional endocrinology and clinical nutrition, I'm able to investigate why people develop what's called disease, and more importantly, we start to unravel the metabolic dysfunctions that's causing all these horrible symptoms that you guys are developing. Symptoms like high blood sugar, high blood pressure, high cholesterol. These things are all caused by organ dysfunctions, hormone imbalances, nutritional deficiencies, autoimmune diseases that are not being treated properly or are not even being diagnosed. We see a lot of different triggers that causes the body to dysfunction over time, therefore leading to a lot of symptoms. Today I want to speak to you about peripheral neuropathy. Now, peripheral neuropathy, there's over 100 known causes of neuropathy. Now, we know that the number one cause of peripheral neuropathy is diabetes. Over 40% of people that deal with neuropathy, it comes from diabetes. Now, we also see a lot of other conditions in our office that are causing neuropathies. Most commonly things like chemotherapy treatments, drug interactions, B12 deficiencies, trauma to the lower back or to the neck causing neuropathy in the hands and feet. But really, regardless of what the neuropathy is caused by, the actual damage to the nerves or the mechanism of the disease process is very similar. And so I want to talk a little bit about what neuropathy is, why it is that you're getting all these abnormal sensations in your hands and feet that eventually leads to discoloration of the feet, and with a lot of people leads to losing toes and feet over time. And so with neuropathy starts as a nerve problem. Now there's, again, over 100 known causes of why these nerves become sick. But what happens is the nerves become a dysfunction. Now we have to understand that the nerves control everything in our body, okay? And so when nerves start to dysfunction, a lot of other things are going to not function properly as well. And so with peripheral neuropathy, again, starting in the hands and feet, we'll start to get a lot of tingling, sharp pains, numbness, stabbing pain, burning, cold all the time. A lot of patients explain it that you have a lot of numbness, but at the same time there's a lot of pain at the same time. And so the reason why you're getting these abnormal sensations is because the tissue is starving. The tissue is starving of nutrients, it's starving of oxygen. Also, metabolic waste is beginning to build up in those tissues. And the reason why this is happening is because the blood flow is affected. Now, with a lot of people, they say, well, I have normal blood flow, and that's the blood flow into the arteries. And the arteries are the bigger blood vessels, and that's what carries blood throughout the body. Now, in order for your tissue to get fed, the capillary beds, which are the very tiny blood vessels in your system, those capillary beds need to be able to fill with blood and feed the tissue with oxygen and nutrients, and also take away that metabolic waste. And so as this neuropathy condition progresses, the nerves are affecting proper blood flow into those capillary beds. Now, once the capillary beds don't get blood, now the tissue's not getting oxygen, the tissue's not getting nutrients, and the tissue begins to decay. Our body's way of telling us that there's a problem is pain, right? And so, again, the list of different types of sensations are just a mile long because there's different nerve fibers that send different signals to the brain. So depending on what nerve fibers are affected, and sometimes it's all of the nerve fibers, but depending on what nerve fibers are affected, it will cause a different type of sensation in the foot, whether it's a stabbing pain, a burning pain, tingling, numbness, and again, any other pains that you may be experiencing. Typically what we see is you start to experience this condition, you go to your primary care physician, the doctor tells you that you need to go see a neurologist. The neurologist will meet with you. Sometimes they will do a nerve conduction study an NCV on you to confirm the presence of nerve damage, but many times that test is not even completed. The reason being is because the symptoms are pretty classic. Once you start to get numbness, tingling, pain, burning sensations in the hands and feet, 99 out of 100 times it is peripheral neuropathy that you're developing. And so what these doctors will typically tell you is there's not a whole lot that they can do. They will put you on medications like Neurontin and gabapentin, and if those are not doing the job as far as keeping you out of pain and misery, then they will do the next thing as far as taking the next step to more powerful drugs like Lyrica, Cymbalta, that just have a larger impact on brain function and on the nerve function in order to decrease the pain. The scary thing about these drugs, folks, is that the drugs are not fixing your condition. So if you're taking 1,200, or 1,500, or 2,200 milligrams of gabapentin or Neurontin, and the pain is severely decreased, I mean, that is great that you're not in pain, but you need to understand that the condition itself is still there, it's present, and in most cases, it continues to get worse. This is why over time, you need more and more medication in order to keep those pain levels down. My approach to treating peripheral neuropathy is night and day compared to the conventional approach. There is things that we can do in order to heal and reverse your neuropathy condition. I'm going to be talking to you more specifically about what those treatments look like in this next video. Again, we need to fix a couple different things. Number one, the nerve is sick. And so we need to get that nerve more healthy, okay? The myelin sheath is the conductor that wraps these nerves, and that's what allows these signals to travel along the nerve path. Once the myelin sheath becomes demyelinated, now those transmissions cannot be sent from the brain to the body. And so now blood flow is affected. As the blood flow is affected, again, like I explained, those capillary beds begin to shrivel up, die off, and now you can no longer get blood into the peripheral tissue. And so we need to not only heal up those nerves, and we have just amazing treatments that we will send home with you. You do these treatments in the convenience of your own home, and they need to be done consistently in order for you to get the results that I'm speaking to you about. The other thing is we need your body to regrow new blood vessels. Now, this is something that your body can do on its own, but it's a very slow process. We see our patients getting just amazing results within the first 60 to 90 days of our program, and it's because of how aggressive we are with this condition. I see all the patients walking into my office that have already lost toes and feet and are trying to save the other toes and feet. And so when I talk to a patient about their peripheral neuropathy, I take this condition very, very seriously. So in order to regrow new blood vessels, we use a very, very high technology of low-level light therapy in order to stimulate the growth of new blood vessels. It's a process called angiogenesis. When you address the disease in this fashion, the results are just amazing, okay? Now, there's a lot of different nutritional aspects to the program. You'll be getting daily emails and just explaining to you how to eat, explaining to you different exercise programs that you should be doing. There's going to be different clinical supplements that we're going to be using with you in order to increase blood flow to the peripheral tissues. We want to increase nitric oxide to those peripheral tissues, and that just speeds up the healing time, increases oxygen and blood flow to those areas. And so again, I want to explain to you more in detail about my neuropathy program. So if you're interested in getting some specifics on what my neuropathy program looks like, what the technology does in detail, I want you to click the link below, and that'll go ahead and take you to that next video, okay? Now, if you found this video helpful, I want to go ahead and just ask you to give me a like or give me a thumbs up, and just share this video with your friends. There's a lot of people out there that are suffering with terrible nerve pain, and they're just stuck on these drugs, and they're just not getting the results that they're looking for. Everybody knows where to go find drugs and surgeries, but there's not a lot of people that know where to go try and go find true health care. And so if you did find this valuable, I do ask you to like this video, go ahead and share it to your friends, and I do look forward to talking to you in the future. God bless.